Welcome. Visiting with us today on Memory Monday is Dr. Dana Smetherman, a friend of mine who is the chair for the Department of Radiology and Associate Medical Director at Ochsner Medical Center in New Orleans. So glad to have you today and so glad to see you.
Yes, it's such a pleasure to see you as well. Really, really glad to be here and glad to be able to talk to you again.
I'll be glad when we can visit personally, but Zoom has been a wonderful way to see folks and visit.
Yes, could not agree more. And to have business meetings, like, for us, we have administratively so many meetings, and we've been able to just transition seamlessly over to Zoom. We use it in our education too, like our resident conferences. Now we do them all with Zoom. Our multidisciplinary conferences, we had our breast conference at 7 o'clock this morning on Zoom. So we are fortunate in this day and age to have these tools to help us at least stay somewhat connected to people.
It's true. It's helped tremendously. So a few years ago, Dr. Smetherman, you and I got to know each other better at Gail Benson's Moonlight and Miracles Gala for the benefit of the Tom and Gail Benson Cancer Center right there on the main campus at Ochsner. We share a passion for promoting 3D tomosynthesis. Obviously, it is your life's calling, and I discovered it, unfortunately, or fortunately, over the years. Can you talk to our audience a little bit about what the difference is between 3D Tomo software and how it's made 2D mammograms obsolete?
So that is a wonderful question, and I really appreciate kind of the way that you have phrased that, because I think one thing we need to remember is that mammography saves lives. And in the United States, since the beginning of mammography back in the 80s, we've actually seen breast cancer mortality decrease almost 40%.
That's incredible.
But we also know that mammography is not a perfect tool. There are cancers that get missed on mammography, and there are also patients who have a screening mammogram. We see a potential abnormality, and then the patient has to come back for additional images. So we have both what we would call false negatives or missed cancers, but also false positives. And we do know that those false positives, where we see a potential abnormality and a patient has to come back for additional imaging, can be very anxiety provoking, even if it turns out to be fine. And so digital breast tomosynthesis helps us address both of those issues. So we can find more cancers, particularly small invasive cancers, but it also decreases the patients who have to come back for additional images. So it really kind of bends the curve in both ways. But I do want to make one really important point, because I have heard this misconception, which I think can be concerning, and that is I have heard patients who say, well, in my community, we don't have digital breast tomosynthesis, we only have 2D mammography, and should I not even have a mammogram? And I would hate for anyone to take that message away, because certainly mammography is the one tool we have that's been shown to decrease breast cancer mortality. And so don't forego a mammogram altogether just because you don't have digital breast tomosynthesis. I agree with you that if you are fortunate enough to be able to have both, absolutely, that's what I would encourage. But don't decide not to have a mammogram at all, because not every community is the same. Not everyone is fortunate to be able to have access to both.
I'm so glad that you mentioned that. It's so important. You should never skip a mammogram, even if the one you're having isn't necessarily at the top of the scale for the best screening. The bill that was passed, House Bill 460 in 2018, did allow for some communities some time to get grandfathered in and catch up. We don't want to penalize anybody, of course, but we want to give them time to catch up to the latest software for their patients so that they do get the best. But absolutely, please don't skip your mammogram, no matter what. It's so important.
And I would say too that not every state is fortunate enough to have that kind of legislation. So again, I think it's just an important and very important message.
I'm glad you said that. That really is important. why do you think it's important for screenings to begin at 40? It seems like this is a point we drive home and try to talk about as often as possible.
So I do think that everyone needs to be aware that the most rigorous scientific studies that have been shown to decrease the deaths from breast cancer all show that beginning screening at age 40 saves the most lives. It's interesting, about 1 in 6 breast cancers actually happen in women who are in their 40s. And if we look at some of our different populations, like for instance, in the Black and Asian and Hispanic population, actually about a third of the breast cancers in those groups happen in women who are under age 50. So particularly in
Wow.
communities like ours, it's very important that women start getting that screening at age 40. There are estimates that actually show that starting at age 40 will save, instead of starting at age 50, will save about 100,000 lives over the course of a decade. So, these are real numbers. And also we think about the life years that are saved. About 40% of those life years that are saved by screening mammography happen in women who are in their 40s. So, I really do think this is something important. And I know that there is confusion, and actually digital breast tomosynthesis helps us in that as well, because some of the organizations like the USPSTF, who recommend women starting at a later age, one of the downsides of screening mammography that they talk about is the harm, and that's their wording, of having to come back and have additional images and the anxiety that causes women. So with digital breast tomosynthesis, where that recall rate goes down, that actually helps to address some of those harms as the USPSTF causes them. So digital breast tomosynthesis can actually help us address, again, some of the shortcomings of mammography and starting at age 40.
And I'm certainly glad that was the standard for me when I turned 40, because that's how I was diagnosed, was my very first mammogram at age 40.
Right.
And so had it been different, I might not be here talking to you today. So I'm very grateful for that.
Right, because then you would have had to wait until you could feel a lump, until you had changes that were big enough that you could see and feel them. So absolutely,
Yes.
very important.
So what if a patient has breast implants? Does that change the accuracy, or does it alter your ability to read the digital information?
So women who have implants absolutely still benefit from screening mammography and from mammography in general. It can be a little more challenging to get a high quality mammogram. And so I always want to make sure that women with implants understand that they will, just as part of their normal yearly mammogram, they will actually have some extra pictures, because we will take pictures that include the implant, but also we will take pictures of the front part of the breast tissue pushing the implant out of the way. So they will have some extra pictures. There is something else that I think it's important for us to talk about in women who have breast implants, and that is a specific kind of rare cancer that is associated with those implants. And it's something that we really just learned about in the last several years. And this is something called anaplastic large cell lymphoma. So women who have implants, particularly those who have textured implants, are at an increased risk of having that rare cancer. What patients should look for, the way this usually presents, is you've had your implants for several years, and all of a sudden you'll notice that one side becomes swollen, or you may feel a lump, or you may feel a lump in your armpit. It is a very treatable cancer, but it does need to be caught and treated, and the treatment usually involves removing the implants and then other therapy as well. But it is a relatively new thing, so I just want to make sure that our patients who have implants are aware of it, and if they notice one of these changes, to make sure they let the doctor know.
Wow, I learned something today. This is particularly useful information for women who have had reconstructive surgery and the choices
Absolutely.
they make moving forward regarding a textured implant. Wow, that's scary to go through all that and then have to be concerned with that. That's really very, very interesting. I'm glad you made that point.
And I think too, it is rare, but it's important, and it's something where the data is really just evolving right now. So we do want to get the
Mhm.
word out.
And once you've had cancer, you certainly don't want to put yourself at risk for additional cancer.
No,
Uh,
no.
no, for sure. What does it mean to be high risk for breast cancer?
So that's a great question. In breast imaging, we usually define high risk as having about a greater than 20% lifetime risk of breast cancer. The American College of Radiology, and I'm the chair of the Breast Commission for the American College of Radiology, we recommend that all women have a meeting with their doctor when they turn 30, just to talk about what their real risk factors are. It's always interesting to me. I have patients who think that they're very high risk and they turn out not to be. And other patients who don't realize that they're high risk. The American College of Radiology in particular wants to make sure that our patients of African descent and Ashkenazi Jewish patients are very much aware, because those individuals do have an overall increased risk just in general. If we find that a woman has a greater than 20% chance of developing breast cancer over her lifetime, we may recommend that she start screening earlier. We may also recommend that she have, in addition to having mammograms with tomosynthesis and possible, that she also have breast MRI as well. So we do sort of an enhanced screening regimen for those patients. So, and I think it's really just about awareness. I think it's very important for women to understand their risks, to know that there are different strategies available. And now at the Tansey Breast Center, for the last 2 or 3 years, we actually put that risk score in our patients' reports. And that's based on the information that we have in our electronic health record. So again, and it's kind of a flag. And if you are over 20%, what we would like to do is make sure, A, that you're aware, and B, that you can come and speak with one of our breast surgery personnel, have an even more in-depth analysis of what your risks are, and then potentially have some additional screening, just to make sure we're really doing a good job of surveillance. One thing I do want to remind everyone of, though, is that with those patients, we know they're at really high risk, but most of our patients who develop breast cancer don't have a known family history. I do think there are a lot of patients who think, oh, it doesn't run in my family, so I'm off the hook. Unfortunately, that's not true.
You're right. That was the case for me. I did not have a family history, and right out of the gate on the first mammogram, was diagnosed with a stage 3 breast cancer. So it's it's definitely good to be aware that there isn't necessarily a family history for you to be at risk, which is why it's so important never to skip your annuals, ever, ever. Not allowed here. No coupons for that. So it's my understanding that simply being a Louisiana resident, our risk for having some type of cancer in our lifetime is greater than maybe other Americans in other parts of our country. What advice can you give to our audience to limit our exposure to environmental risks that Louisianians face daily?
So actually, this is a really interesting question, and it is something that I think we are all learning about. I've actually seen presentations given by my colleague, Dr. Rich Milani, where he talks about the presence of different kinds of pollutants in the air and the development of different diseases. So I'm not going to tell you that, oh, do this, do that, and we in Louisiana are all going to be safe. But I do think another important thing we are really going to have to evaluate, and there was some research that came out of Ochsner, is some of the underlying chronic illnesses in our communities that have really put us at risk of having a higher death rate and more serious complications of COVID. So things like hypertension and diabetes and obesity, which are obviously also very prevalent in our community and probably above average for the country. And these have, we've kind of laid bare the risk that this is putting all of us at. So I do think that, although I don't have a great answer of how we might avoid all of the environmental pollutants and which ones are going to turn out to be important, I do feel like the data that we're seeing on the patients who are not surviving or doing well with COVID has made me really think about what's going on in our community and how could we do a better job of making sure that our citizens are treated for those illnesses and avoid the ones that they can.
Yes, with those underlying disadvantages of illness, it does make you vulnerable, not just in a everyday situation, but especially during this time of COVID, quarantining and social distancing. And how has the pandemic affected the usual day-to-day operations at the Tansey Center on Jefferson Highway?
So very, very interesting question. We did make the difficult decision in March when we could just see the cases escalating in our community and increasing exponentially, to not do screening mammograms. We wanted to make sure our patients could stay at home, could safely social distance, and didn't run the risk of actually acquiring COVID, just because they're coming into a healthcare facility. So it was not an easy decision for us to say postpone your screening mammograms, but we did because we really felt like it was the right thing to do. Fortunately, we have been able to reopen, and we did stay open the whole time. Just to be clear about that, if we had a patient who felt a lump or had a very serious condition or mastitis, we did continue to see those patients, but it was really the patients who would have been due for their screenings. And so now that we have reopened sort of slowly, we're bringing those patients back who may have missed their mammograms, trying to get everybody back on track for their yearly mammograms. Things will look a little different though. We are requiring everybody to wear a mask, to try to, and us as well, as the physicians and the technologists, to keep everyone as safe as we can. We do temperature checks and symptom checks when they come in, and we actually contact the patients the day before to see if they're having any symptoms, so that we can, maybe they need to wait a couple of weeks. If it would turn out they have COVID, wait till you're better. Also, you will note that people will notice that we have really moved everything apart in our waiting rooms, and we're having fewer patients in the waiting rooms. Sometimes we're even asking patients to check in as they're driving up and wait in their car, and then we just meet them in, right in the lobby and bring them straight back to minimize the time that they're in the facility. But I also want to let patients know that we really feel confident now with all the changes that we made that patients are safe to return to come back for their health care. So I certainly understand why people may have had reservations and wanted to be sure that as they came back for their routine health care, that things were as safe as possible. And I really do feel like the changes that we have made will enable our patients to come back, get back on track for their screenings, and get all of their other healthcare needs taken care of.
Can't emphasize enough, don't skip. Even if your appointment was postponed, please follow through. It's just so important. And it sounds like you guys have matters well in hand. Are you in the new facility, in the new building?
No, we are actually very actively working on the move right now. I'm trying to make sure that we minimize the downtime so that we can basically go right from the old Tansey Center across the street to the new facility. I actually did a walkthrough last Friday, and it looks great. We're really excited to be back on the other side of the street. And I think it'll be great too, especially for our cancer patients, to have such ready access to all of the different resources of the Benson Cancer Center. So, we're very excited, and we're probably looking middle of the summer. I don't have an exact date yet, but we're trying to time everything so that we can make it as smooth as possible for our patients.
Well, it is beautiful, and I got a walkthrough tour not too long ago, and was so excited to see the spa-like environment, and it's extremely tranquilizing and definitely puts you at ease right away, especially when we have physicians like you, who are so passionate and compassionate to patients. And I can't thank you enough for joining us today. I wish you the best, and I hope we get to see each other soon.
I know. I likewise look forward to the opportunity of seeing all my friends in person again. Please stay safe, and we will all figure out how to live in this new and different world together.
Yes. We truly love our endowment partnership with Ochsner. You guys have been so incredibly supportive of KTSRBI through the years, and we can't thank you enough for it. So ladies, please make those appointments and visit the New Breast Center, and remember to demand 3D always.
And Karen, thank you. I mean, you have been just an incredible partner, done so many things. And I really love how your focus is on helping the individual patient, the individual woman. And so we cannot thank you enough. So as I said before, stay safe.
Well, it is my pleasure, and you do the same. And we love you guys and hope to see you very soon.
Okay. Have a good afternoon.
Take care. Thank you.
Sure. Bye.